Doug Field, CEO of the Institute for Healthcare Consumerism, and welcome to Healthcare Consumerism Radio. And with me this morning is my co-host, Todd Callahan, our Editorial Director. Morning, Todd.
Morning, Doug. Good to be here.
Yeah, it's a nice rainy day in Georgia. And we also have with us our first guest coming to us from snowy Minneapolis, the CEO of CieloStar, John Reynolds. John, good morning.
Good morning.
How is it up there in Minnesota today?
It's a winter wonderland today.
You're getting part of that blizzard that's hitting the Midwest, huh?
Yes, we are.
Well, John, listen, I really appreciate you taking time out of your schedule and being with us this morning. John and I were just together a week or so ago here in Atlanta, so this is becoming commonplace. So, John, listen, I'd like you to talk to our audience a little bit about, what you're doing with CieloStar. I think you have a very unique position in this space, what you see as far as the market trends around exchanges. So if you take a couple minutes and just kind of give your background and give kind of the genesis of CieloStar to our audience, I would appreciate it.
Great. Well, thank you. It's a very interesting time for us in this market space. There's radical change happening all around us, some of it being driven by economic issues, some of it being driven by, very radical changes that are coming at us in the form of new legislation as it relates to healthcare. So really, with the passage and enactment of the Affordable Care Act, the whole landscape of the healthcare space in this country is on a course to undergo, dramatic changes. And over the next several years, it's going to require that almost everybody who consumes healthcare, including employers, are going to have to make drastic changes, not only in the way that they provide for their healthcare needs, but also in the basic philosophy that surrounds the healthcare issue. And that has big implications. Obviously, consumers are going to need expert guidance to make the right decisions, what will become an even more complicated array of choices as we look forward. So as a company, we're perfectly positioned to offer expertise that's really unequaled in consumer-directed healthcare. And as a leading healthcare benefit technology and administration company, we offer directed healthcare plan administration, defined contribution benefit administration, healthcare payment processing, risk transfer, health screening, health coaching, consolidated billing, participant communications, enrollment support, COBRA administration, incoming and outgoing call center services, wellness, private exchanges for employers, consumers, affinity groups, and even government. So as you can tell, we've got a very, very broad set of solutions that are all owned and operated inside of our company. We're in our 25th year in business. We emphasize the technology side of the benefit management administration business. And the services that we have are really marketed as 5 distinct product families. There's CieloSource, which is backroom administration. There is Benefit Ready, which is benefit administration and enrollment. My Cielo Choice, which is a consumer portal for managing healthcare products, which are the direct consumer products. Cielo Choice, which provides the private insurance exchange, payment processing, and wellness offerings. And then Cielo Care combines all aspects of the private exchange technology, back office administration, and call center, along with risk transfer and medical claims processing that powers the evolving accountable care organization and cooperative markets, which is a huge evolving new area as a result of both economic pressure and the Affordable Care Act.
That's quite a well-rounded solution. I think today employers need that help as the consumers do. When it comes to the exchange market and defined contribution, I think we've got, employers are very confused right now with public-private exchanges, defined contribution, minimum meeting the minimum essential benefit requirement. I mean, talk a little bit about, defined contribution and the public versus private exchanges.
Well, Doug, we're at a very important juncture in this country, and the whole old model of healthcare is changing fast. So these changes are really being forced by what I would characterize as decades of runaway double-digit inflation in healthcare expenditures.
Right.
At its core, the changes entail a shift away from what would have traditionally been thought of as a defined benefit model. And we're in the midst of this shift to a defined contribution model. And in a lot of ways, it's very similar to the shift that occurred in most retirement plans. These have shifted from the traditional company pension or a defined benefit plan to a retirement landscape now dominated by the 401k plan. So here's an example of how this shift works in healthcare. Instead of an employer offering a set menu of benefits to employees, the traditional medical, dental, vision, et cetera, the employer will offer a set dollar contribution for the employee to spend on his health care needs. And this is going to result in a great deal more choice for consumers, as well as far more complexity involved in those choices. So all of this is opening up just a huge, gaping need for some type of tool, a technology tool to guide consumers through the coming maze. Such tools have been developed and deployed to help with such revolutionary change in the banking and the financial service industry. We've seen this in the travel industry. This technology is going to wrap together and provide the background and the decision support for all pieces of the healthcare puzzle. Mm-hmm. Major medical, dental, vision, life, disability, and long-term care insurance as examples. And equally important, the technology would allow for the nearly instant payment processing for this healthcare, with the goal of eliminating the extremely inefficient and costly payment model of providing the service, generating a bill, sending the bill, finding the customer for payment, and then chasing the customer for payment. And I always, I spent a lot of time in the banking industry, and so when I think about some of this, the greatest example of this kind of transformation into a more efficient transaction model is the banking industry. It wasn't really that long ago that the concept of obtaining instant cash out of an ATM machine at a local bank branch was hard to imagine.
Yeah, you're right.
Much less having that access in countries all around the world. Today, that's exactly what the banking industry has been able to do. Insert a card with one magnetic strip anywhere in the world, and out will come currency in the local denomination. No questions and no paper involved unless you want a receipt. Now, if you were to apply that same process in the healthcare industry, it would probably take about 3 days for that cash to come out of the machine.
Yeah, you're right. Yeah. Where do you see public-private exchange? Talk a little bit about the competitive nature of public and private exchanges.
Well, the public exchange has its origins in really serving that segment of the population that in the past has not had access to health care. Mm-hmm. And the primary focus of these state exchanges has been very much first and foremost on major medical only. So when we think of what it is that the state exchanges are going to offer, first and foremost, it's major medical only. So if you think about it from the perspective of an employer who has to contend with multiple other benefits, this is really only one piece of the total benefit equation. And the core engine of what's happening behind the scenes for that public exchange entails really verifying eligibility, first and foremost, that the individual or family will qualify based on their level of income. And then secondly, facilitating the integration of the subsidy with the premium payment. So that's in large what's happening, or what the real mechanics are behind the scenes with these public exchanges, focused primarily on major medical only, and then it's the facilitation of the marrying up of the subsidy with the premium payment. Now, for employers who have to engage in that market space, you're going to be left with still needing to accommodate all of the other related benefits that you may choose to offer. So we're finding, just rapid growth occurring on the private exchange front, even as these state exchanges are beginning to form. And in part, we feel pretty strongly that the private exchange model is the most likely survivor in the long term, because the private exchange model is going to offer the complete set of solutions for an employer, and would also, even for individuals who are looking to purchase, whether it's major medical insurance, dental, vision, long-term care, or any of those types of products, it'll be one place to go for all of those types of coverage. And in effect, you can, through a private exchange, you can also accommodate the public component. So for those employees who do qualify, for example, for some form of subsidy, there is a way that you can integrate the major medical components with what's going to be offered on the public exchange. So it's a fast-changing area. As you can see, the political debate is ongoing. We have, as of right now, we've got 17 states that have opted in one shape or another to effectively either create or build their own public exchange offering. And then you've got other states that have decided that they're going to go with whatever it is that the federal government offers up in that regard. And then we've got about 26 states that haven't opted to build their own or to sign on necessarily with the federal government. So I think it's going to be very interesting over the next few months and over the next year to see how this all really shapes up. I wouldn't be at all surprised if we see some of these deadlines that have been established get pushed out, possibly even another year. We've seen that with ICD-10 as an example, and it wouldn't surprise me at all that some of these deadlines get pushed back, which also works to the advantage of the private exchange, so that in that intervening period, private exchanges are going to have the opportunity to really take hold and demonstrate their efficiency in solving this very same problem.
And John, that begins this fall, correct? I mean, in this upcoming 2013 benefit enrollment period, correct?
That's correct, because it all really starts to kick in 2014. Yep. January 1, 2014.
Right. And, John, isn't there a lot of tighter deadlines for the public exchanges to actually define what is going to be in the public exchange coming up, I think, in March?
I believe that's right, and that's why I think kind of coming out of some of those discussions, we're very likely to see more change.
Hey, John, we got about 1 minute here, and time flies when we're having fun. If you can kind of give my audience a real wrap, if you can give them a nice 1 minute takeaway, I'd really appreciate it on CieloStar.
Well, we're at a very important juncture. The whole model of healthcare is changing radically, and as we look to the future, there's no doubt that one of the pathways to resolve some of the inherent inefficiency in the current healthcare industry is to deploy technologies that are have been available in other segments of the business for quite some time. This online health management tools, and while many people already go to their particular health insurer's website and can access wellness tools and personal health records and things like that, we see that there's just a tremendous opportunity for us to engage the free market system, to engage consumers in a more meaningful overall experience with their health care, not just in managing cost, but also managing their well-being and their wellness. We think it's going to be a very important shift that's going to occur really over the course of the next couple of years in particular.
John, I really appreciate it, and I do hate to cut you off. You have a great weekend up there, and audience, stay tuned. We'll be back in a couple of minutes. Thanks, John.
All right. Thank you, Doug.
My name is Todd Callahan, the Editorial Director for the Institute for Healthcare Consumerism.